All right, folks, it's 4 o'clock, so we'll get started. Thank you all for joining us today. I'm going to go through our agenda and do introductions and all of those sort of things. But first of all, I'm going to mute some of you if you're making noise in the background, just so that we're not bleeding into other people's time there. So I'll start just with some Zoom etiquette sorts of things. First, this meeting is being recorded. It's also being live streamed on our Facebook page. So although this is not a meeting of a school board and is not subject to the right to know law, we're treating it as such and are making this meeting available to the public. Right now, there are 53 people from the public watching this meeting through Zoom, and I'm sure there are several others on our Facebook page. So this is a public meeting in all regards. Included in the meeting are our panelists, which are people I've invited to participate on the task force directly. I'm going to talk through the structure of this task force in a bit, but people that are panelists are people that are participating in this meeting directly, and attendees are those who are observing this meeting and watching, and we hope will participate when we have the opportunity for them to do so. Whenever you can, if you can mute yourself when you're not speaking so that we don't have that background noise, that'd be great. I would prefer that panelists try to keep their video on during the meeting so that we can, to the extent possible, have normal interactions through this artificial means. Anybody that has a question or whether an attendee or a panelist that would like to speak, you can start talking, or you can certainly use the raise hand feature that's built into Zoom, and we'll get to you when possible. So those are the introductory Zoom sorts of things. I want to thank everybody for participating. We have a simple task, and it's to figure out what in the world we're going to do about school this fall. So I'm calling it simple. It may not be, but we all know that we have a great task in front of us, and I have confidence that the collective wisdom of this group and others in town will lead us to making the right choice for our students and for our town. So I just want to thank you all for taking the time to do this in the summer when there are much more fun things to do besides solve problems like these. What I'd like for the panelists to do is we're not going to take the time to introduce ourselves one at a time. Instead, what I'd ask you to do is in the chat feature of Zoom, take a minute, and if you can, type who you are, what your connection is to the school system, and how you're participating. Anything else you'd like to add. When you send that, please make sure you send that chat to also all panelists and attendees, so people who are watching can observe and see what you have to say. So feel free to do that at any time during the meeting. We will have opportunities for public input for this task force. Most of that will occur at the subgroup level. We have 5 subgroups I'm going to talk about in a few minutes, but that is where our primary opportunity for public input will take place. And we will have some time in these meetings, I think, as well, if possible. But again, the purpose of these meetings is to solve the problem. We can't do that without public input, but we also can't spend most of our time collecting that input at this level. And so instead, we're going to target that input gathering at the subgroup level. My goal is to have weekly meetings between now leading up through August 1st with an initial hope that we have our plan in place and ready to go by August 1st. And so every Thursday at 4 from here on out, the plan is to have these meetings and to move forward towards our reopening plan for August. And that speaks to the structure of this committee. So the 5 subgroups that are going to be commissioned as a part of this are, the first is our school nurses and the community medical professionals. That group of people who will be giving us both the scientific, medical, and practical input and guidance about our reopening plan. I've asked Jim Manning to serve as the chair of that committee. I also expect Deanna Quartz to play a big role in that, as will all of our school nurses that will be a part. J.M. Vore and Melissa Schuft have expressed interest in being a part of that subcommittee as well. And if there are others, I'll ask Jim Manning to coordinate that collection of people from our community to advise that subcommittee. Our next subcommittee is principals and administration, including those from other places. Anna Perro is our chair of that subcommittee as the principal of Clark Wilkins Elementary School. And then all of the school district principals and several other administrators will be a part of that group, as well as 2 people from our community. One is Dr. Henry LaBranche, who is on the task force, has been a mentor of mine for many years and served as a school superintendent in several school districts in the state of New Hampshire, and is a great resource for things like this. As well, for that subcommittee, Dan Black, who's an assistant superintendent in the Londonderry School District and also a parent in town, will be a part of that subcommittee. And anybody else from in town who's an administrator who would like to be a part of that can certainly be a part. Our third subgroup is our faculty, staff, and associations subgroup. That includes representatives from all of our groups of teachers, our paraprofessionals, our support staff, and their associations that represent them. Serving at the task force level are both Katy Kennedy and Jolene Sawyer and Steve Dreher are sharing that role from Sauhegan. But at the subcommittee level, several teachers have expressed interest, and I know that they'll all be a part, including the presidents of the various associations that represent our employees. And I've asked Stephen O'Keefe and Amy Facey as SAU board chair and previous chair to head up that committee for our faculty, staff, and associations. Our fourth group is our parents and community members subgroup. That, of course, is going to be representative of our parents. I'm proud that all 3 of our moderators of our 3 school districts are a part of the task force and will be a part of that committee. So Peter King, George Bauer, and why am I blanking on your name? I'm looking right at you.
Nate
Jensen. Thanks, Nate. Are on this committee in that subgroup, as are our selectmen representatives, Kim Roberge from Mount Vernon and Reed Panicetti, who is our selectman from Amherst, as well as a state representative. Steve Frates is on that subcommittee as someone who has helped out with school data for us for the last several years. And I've asked Shannon Gascoyne to chair that subcommittee. And so if you're interested as a parent or community member, we'll give you an opportunity to sign up for that committee and be a part that way. And our fifth and final subcommittee is, of course, our students. I've had several students reach out to me already asking to participate, and we'll give that opportunity to our students to be involved. Georgia Craven, who should be on this meeting if she's not already, is the moderator of Community Council at Sauhegan High School for this year, and will be the chair of that subcommittee on our behalf. And so again, the purpose is that those subcommittees would be the place where people can provide input to us. That input can be sorted out and then brought back to this task force and reported back to us to make sure we're hearing from all sorts of different folks. I think those are all of our constituencies that are representative of our community. When I say parents and community members, I mean those that may not be parents, those that are have an interest in our school system beyond just being someone who lives in town and might be interested in our community. So with that, before we start rolling into the rest of our agenda, I'll ask of the panelists that are on board so far, any questions that you might have about our structure or how these meetings will work before we get into our agenda. I don't see any hands up or anybody pointing at me, so I think we're good to continue. So our agenda for today is to first identify the questions that I think we need to answer on behalf of our community. I want to have some understanding of whatever science is out there in a briefing, which I've asked Jim Manning to do that, and he'll do a very brief briefing as far as that goes. Mike Berry, who is the incoming principal of Sauhegan High School, is on the the Commissioner of Education's task force for reopening. And so I'm asking him to give us an update about how that task force is going. And then our final agenda item will be to review some survey data that we've already received from our community about reopening in the fall. And so, and let me just, I need to send a invite to one person who didn't get one. That's done. So, and I see all of the information in the chat from folks. So thank you for doing that. So our first item is, what are the major questions to answer? When I say major questions, I mean, what are the significant questions under which there will be several or many other questions like it. So these are not all of the questions we need to answer, but just my brainstorm of the 5 major questions that we need to wrestle with. And so the first is, what is the right overall modality for school? And what I mean by modality is, what does our school sessions look like? Do we look at, is school just a regular school year in the fall and nothing is different? Do we have split sessions? Do we alternate attendance somehow? Do we give parents a choice? Do we start fully remote as we've ended the school year until something changes in our society? And so that's obviously the most important and critical question. And I would say to our team here that we need to remember that we need to reflect what our community is looking for an answer from us. And that might mean we have to look at something completely different that maybe none of us have thought of before, or that other school districts haven't thought of before as we look at that. Someone mentioned to me, and by the way, I've had several suggestions from people, which are great and very helpful, but we need to think about things that maybe we would never otherwise consider, like starting school early when transmission of virus is low amongst all different types of viruses, and in anticipation of needing a longer break somewhere during the school year, during the peak of virus season, things like that. And so I'm not advocating for that. What I'm saying is that as a group, I think we need to be open to all sorts of different potential solutions, and that those solutions have to be reflective of our community's expectations for us. The second question is, what is the best way to track individual student progress, growth, and achievement? During this time, we already know that remote learning these last 3 months has been successful for some students. It has not been successful for others, and there's a group of students in the middle. And as we start and think about another school year that is disrupted in one form or another, it's going to be critically important that we're tracking student progress at the individual level and have a plan for students to make sure that no kids are falling through the cracks. And this group needs to wrestle with how we best do that. The third major question is, what competency recovery mechanism should be employed for school startup? Meaning, I'm making an assumption that I don't think is a big leap, that there are some gaps that students have experienced because of remote learning, and what are we going to do in response to those gaps to make sure we're catching students up and that they're not falling behind. The fourth question is, whenever we access our buildings the next time, we know that's going to happen sometime, is what safety precautions should be put into practice? All of those things, all of these questions interact with one another, certainly, but what specific safety precautions should we put into practice? And then the fifth is, what's the best way to engage our constituents to make sure that we're representing their interests well and that we're providing exactly what they're looking for school. So those, from my perspective, were the 5 major questions. You can certainly start to list off many, many questions beneath each of those that we need to wrestle with. But I'll ask of our panelists, are there other major questions we ought to consider and add to that list? All right, hearing none, I'm going to call this halfway nervous that no one is speaking, and halfway confident that I've got the 5 questions right. So,
Adam, I saw a hand. I think I saw
Yeah.
Dr. LaBranche's hand up. Adam.
oh, forgive me, Dr. LaBranche.
With respect to the first question, the various modalities that may be considered as we're moving forward, I would hate for us to get, if you will, lost in the weeds until such time as we have some kind of guidance from the State Department of Education. I understand we would have to do some work, obviously, to look at the various models that might be used. But you know, if they come out in 3 weeks and tell us that that we're going to remote learning for the fall semester, obviously our discussion and our planning is not as critical. I think it would need to move forward, but it's not as critical as it would be. So I'm hopeful that your new principal will be able to enlighten us on what kind of progress that the State Board of Education is making as we move forward.
I think that's great. And Mike, when it comes time for your update, we'll be looking forward to that. I will share my little bit of a bias, which is I have a belief that we're kind of on our own at the local level. I'm not anticipating strong guidance from the state level in terms of what we need to be doing in the fall. And the collective opinion of superintendents in the area is that we're largely going to be on our own to figure this out at the local level. So I'm hoping that we get a little bit more from the state, but I'm going on the assumption that that we're left to figure this out for ourselves. But if we get guidance, I 100% agree that we need to not get in the weeds too soon with that. Anybody else with input or questions?
Anna wants to speak.
All right, Deanna, and then Anna.
Adam, I don't think we don't want to lose sight of the social emotional piece for reentry of students. So I think that question, I think needs to be on the table too, and how to support those needs of students.
And my question is the needs of also the staff, to support the staff, because this is a huge emotional issue for them as well. And then the second point was what kind of staffing, extra staffing or staffing adjustments, along with what kind of supplies are going to be needed to do whatever we decide we need to do, and where that's all coming from.
Adam, along those lines, and I know my name says Jolene Sawyer. I'm not. I'm Steve Dreher. But Jolene Sawyer is here as well. But along those lines, I don't know if there's any way we can even anticipate this, because we don't necessarily know what like the federal government's going to do and others. But is there any need to look at budgetary implications as far as staffing goes and other things?
Yeah, so I've taken what Deanna shared and ties in with what you've said, and made question 7 here is what resource adjustments need to be made. Because I think that's a very valid point. Others? Anna, did you have your? Anna, you said yours. Deanna, you said yours. Anybody else? The question. Nate, and then Shannon.
The other thing we might want to consider is ways that we can collaborate with other school districts. Obviously, you've been in touch with other superintendents based on what you've been saying, but it seems to me that there might be a lot of cross collaboration that we can draw on as well, in absence of sort of direct top-down instruction.
That's good. I added that. Shannon, and then Peter King.
This probably falls under question 7, but any modifications to the building? I know the air ducts are being cleaned out this summer, which is great for airflow, but if there's any other building considerations, I would be interested in that.
All right, I've added that as a sub question under what safety precautions should be put into practice. I think that ties in there. Peter King.
So I think Shannon just asked almost the same question I was going to ask. Is I think facilities, I know they fit under administration, but often the building itself may need to have certain modifications. And I want to make sure that that is captured in this committee, so that the facility directors understand what needs to happen to the buildings to make them safe. from a physical perspective. So it's kind of the same question Shannon just asked, I believe.
Along those lines, transportation needs to be considered. I'm not sure if that's a subcategory of one of them, but that's a big one as well.
Got it. I'm putting that under number 1 because that's a critical part of the modality goes there. Katy Kennedy.
Staff members who live in different towns and have children that go to different districts. I know that's come up a lot in staff conversations when talking about hybrid models and things like that. Like if I'm in the classroom all the time, but I live in Greenfield and my kids go to school on Tuesdays and Thursdays. So that's just another piece to think about.
All right, I've added that to number 1 as well. Others. Okay, so in short, we've got to figure it all out. Those are great questions, and that's a great start. Okay, shifting. There's no other questions about our questions to answer. Jim Manning, would you be willing to give us a brief update from your perspective about what's out in the scientific world?
As you know, I have to be careful what I say here. I think the most important thing that we need to consider as we go through the planning here, and I think Dr. Henry had alluded to this, is that there are so many critical unknowns because we're dealing with a novel coronavirus and SARS-CoV-2. So there's just going to be a lot of unknowns, and I think one of the things we're going to have to manage is the expectations the community has around what's accurate and factual information and what's not, and how that information can change over time as we learn more about the virus. You've heard a lot of things in the press. I think the most recent controversy was the WHO statement on asymptomatic patients versus pre-symptomatic patients and what that means. Those things cause a lot of confusion, especially given the fact that when you're dealing with people like from the WHO, they're talking about they're using very technical scientific language that is accurate to the WHO, but when it falls on the ears of a layperson or a regular community member, it can sound like they don't know what they're talking about. So we're going to have to be really, really careful about managing that. There are some things that we've learned about what's going on in New Hampshire. One of them is New Hampshire's done a really good job of quote unquote flattening the curve. So again, and I'm sure everybody knows this because we've had it as ad nauseum, but the strategy was really to try to limit the rate of infection to not overwhelm the healthcare system until such a time that we have either a treatment or a vaccine. So we've done a really good job of that. To date, 5,000 plus people, you might have heard the governor's update today, 5,000 plus people have actually contracted COVID-19. About 10% of those people have been hospitalized, about 506% of those people have died. So those are numbers that are consistent with what you're seeing globally here in New Hampshire. So those numbers are consistent. And so we've seen that curve flatten and remain flattened. The issue is that the curve is flat. It's not necessarily going up. It's not necessarily declining in the state of New Hampshire. So we have to continue to have a heightened state of awareness in terms of what the virus is going to do over the next several months. I was on a briefing last week, and I think everybody in town, everybody in this group should expect that you're going to hear things. You're going to hear things from the scientific community through the summer that, you're going to see in the United States potentially 30,000 deaths in the United States per month from now until this time next year, if we don't change what our national policy is. When I say national policy, I'm talking about testing, contact tracing, and then isolation. So we don't have a national policy around that. So those types of things are going to scare people, and it's going to cause people to be unnerved. But there are some things that we know about SARS-CoV-2 and how that progresses to COVID-19 that we can rely on. Face masks, regardless of what kind of face mask it is, does limit the rate of infection. So we may have to rely on that significantly. We're going to have to talk about how that impacts kids in our schools if they go back, young kids, high school kids of all ages. The other thing that we're going to have to consider is outside transmissibility. So we may have to think through things like starting school earlier, getting kids outside of the physical plant while they're in school, while we have weather to our. So there's things that we're starting to learn about how people get infected from SARS-CoV-2 and have that go on to progress to disease that we can use to our advantage. But it is it's highly dynamic right now, and it's changing, and we should be prepared to address that between now and at least until the end of the year. The only other thing that I wanted to say is I've personally gotten some questions. I got questions last night at a meeting that I was at about a vaccine, and although what we're hearing about a vaccine is very hopeful, the chances of us actually having a vaccine for widespread use probably realistically won't be until about this time next year. So and certainly those things can change, but that is the optimistic. That's the optimistic reality of having a vaccine, whether you're talking about any number of the vaccines that are available, including the Moderna vaccine, which is the mRNA vaccine. So I think that's really it, Adam. That's kind of some of the things I wanted to touch on, unless you have any additional comments or questions.
That's great, Jim. I think two things I would mention is, one, the New Hampshire Department of Health and Human Services is publishing a daily press release of information and data. And I've added that in our Trello board under resources, a link to that board. That's where a lot of the data that's germane to the state comes out. And the second is something Jim said to me, that we are likely going to be thinking about this and dealing with this for at least another year. And to me, that's a pretty critical piece of information, because that tells us, at least tells me, that this is a several year process in terms of our response, because in just my opinion, we already do school the most efficient way possible. That's why we designed the school system that we have. And anything that we do differently, that we've already done differently, is not going to be as efficient or as effective. And thus our responsibility to our students isn't going to change. And we're going to be thinking about this for the next several years, in my opinion. Any other questions of Jim from the group, or anything anyone would like Jim to highlight or talk about? Shannon Gascoyne?
I'm just curious, Jim, if you have any insight into, some other countries who are a little farther ahead of us with this, lessons learned there with reopening schools, or anything that might be beneficial for this group to think about.
We probably want to address that once our subcommittee meets, and we can get hopefully some other folks involved, like John Vore and some others. I will say though that we know the public health community knows how to address this. It's widespread testing, it's contact tracing, and then it's putting those people who are infected in quarantine. And we're not really doing that to the extent that we need to, that we need to be. We were doing about 400,000 tests nationally in the United States. We probably should be doing 3 to 5 million daily, and we're not doing that. Other countries have done a much better job of testing, contact tracing, and quarantine or isolation, whatever you want to call it. But beyond that, I think countries are still learning. We're still learning about this. It behaves very different from this virus behaves very different than SARS-CoV-1.
Thanks.
Mm-hmm.
Jim, when you mentioned SARS-CoV-1, I know you're referring to the what we called SARS back in 2010, I think it was. But could you just take 1 minute and explain to our group what SARS-CoV-2 stands for and how it relates to COVID-19, just so that we all have that same baseline of information?
Yeah, I mean, they had the SARS epidemic in Southeast Asia in 2003. And the interesting thing about that was, so if just by way of example, if you look at what happened in Taiwan, Taiwan's had very few cases of COVID-19. Why? Well, it's because they were right on the doorstep. They were right on the doorstep of what at the time was called SARS, just SARS, which had, I think it was about a 10% mortality rate, or actually was greater, I think. So they've had this plan in place for almost 2 decades. So SARS-CoV-2 is just another iteration of that coronavirus. They're both coronaviruses. There's a lot of different types of coronavirus. This is the second.
Thanks, Jim. Any other questions of Jim? All right, great. Mike Berry, incoming principal of Sauhegan High School, talk about jumping into the fray. You are our connection to the Commissioner of Education's task force on reopening. Would you mind giving us an update for our benefit?
Sure. Afternoon, everybody. So my role on the committee is twofold. One, I'm on a subcommittee of the overall task force, and that's the
way to go.
All right, we're in business again.
Yep, that's better, Mike.
All right, sorry. So I'm on the operations subcommittee of the overall task force, and we're focused, one of the ones I'm focused on is operations. So I can speak more to that because that's where the work is. However, the overall subcommittee hopes to make recommendations to the commissioner, who then will make recommendations, to the governor by June 30th. Then, so Adam, I kind of agree with what you're saying. We're a little bit on our own. Then more specific guidelines will be given out to people within 30 days. So by the end of July. So then you're looking at the end of July, trying to plan for fall, and you're getting kind of like guidance throughout the summer. So where the task force is at now is each subcommittee has met twice. The overall committee has met once. A survey has gone out. They had really great feedback. 53,000, I believe, is the number of surveys that were completed around the state of New Hampshire. The group that's facilitating through the Department of Education is called the American Institute for Research, AIR. They're facilitating this, and it's through their region comprehensive centers, facilitation. So they got that happening, and the goal is to kind of take 3 things into consideration. It's student and staff safety, it's student, family, and staff comfortability level, and then it's being really flexible based on the safety and the comfortability level of all the other groups. So it's a large project. It's aggressive. I think it's going to give some overall guidance. Some of the conversations, without kind of saying too much at this time from where I sit, is about how to make the guidance as equitable as possible throughout New Hampshire through the various school districts. And so I think as SAU39, you have to do what's best for you based on the guidance and the information that comes from not only the task force at the state level, but where you're at as a local community and the information that you put a value on. I can answer any specific questions if people have them. Right now they're in the analysis of the last thing that we did is that we're in analysis of the data that was collected, so we can begin to make recommendations.
So Mike, again, just to reiterate that timeline, you expect initial guidance from the committee by June 30th and then additional guidance by July 31st. Is that correct?
Yeah. Yes, sir.
Questions?
I don't know when they're going to make when we make recommendations as a task force, I don't know. I haven't heard when those recommendations are going to be made, but relayed to districts. That's something I don't have in my role.
Adam?
Yes, Dr. LaBranche.
Mike's report, the end of it, where he outlined those three elements that the committee is focusing on. I, for one, like the way that was framed in terms of the comfortability. And we've talked about that a little bit in your questions, but I think rolling that language into your questions for the various subgroups would be important.
Got it. Mike, if you could send those to me in written form so I can do that, that'd be helpful.
Yeah, I will.
Any other questions for Mike? Peter King.
Yeah, sorry, I'm unmuted. I was just going to say that there is a way to sign up to participate in the state's webinars when they have the task force meetings. There's a meeting on June 23rd in the morning and another one on June 29th in the afternoon. Perhaps we can post a link if folks on this this committee want to participate or sit in on those Zoom meetings.
That's great. And there's pretty wide participation in those meetings, Mike, is that correct?
Yeah, the initial meeting had right around 1,000 people.
Very good. Any other questions for Mike before we move on? Okay. I'd like to take a minute and share some survey results from this took place been over a month now since we asked this question of both parents and faculty. So I'm going to share my screen and show those results. So the first question was, where does your child attend school? And so we had fairly even participation from our schools, and Mount Vernon Village School is obviously smaller, but we had a significant number of participants from each school. As of today, how comfortable are you with your children returning to school? Precautions are taken, but social distancing is not possible. I will, that's a little bit of a biased question on purpose, and I'll share my bias, which is I have a hard time believing that students of any grade level are going to remain 6 feet apart during the entire school day. We can talk more about that as a group, but I'm just sharing with you that I find it hard to imagine kindergartners remaining 6 feet apart from each other. I have a hard time envisioning 11th graders remaining 6 feet apart from one another during an entire school day. But I asked that question, and 1 was not comfortable at all, and 6 was completely comfortable. And so there's a very wide distribution there. The next question, which was most telling, was if you had to decide today, if precautions were taken but full social distancing at school is not possible, would your children attend school in person this fall? And about 2/3 said yes, and about 1/3 of parents said no. Again, these are parents answering this question, 962 responses. I will share with you anecdotally that I'm receiving emails on a daily basis, and those emails are 2 types of emails. One is school had better be open in the fall because my kid is going to school in the fall, with various degrees of passion included in those emails. And the other emails are, no matter what you do, my kid is not coming to school this fall. And again, various degrees of passion with those emails as well. And I'm getting those every day from parents on both sides of the equation. So I think that we already have, and again, this is month-old data now, but we have a strong contingent of parents that are ready to send their kids to school no matter what, and others that just won't. We broke this down even further and asked the question of both our faculty and compared it by building. so these are the people that said yes, and I'll hide the count because it's confusing. But at Clark Wilkins School, 62% of parents answered the question, yes, I would send my kid to school, and 60% of staff said yes, they would be comfortable returning to work in that same scenario. At the Mount Vernon Village School is 64% of parents and 76% of staff. AMS was 62% of parents and 61% of staff. And then Sauhegan was 71% of parents, but only 56% of our staff, which is interesting. And then let me go back to, there was one other question, is what is your opinion about limiting attendance by either alternating days, split sessions, or other options? And again, 1 was completely against those concepts and 6 was completely in favor. And so interpret those results as you would like, but fairly split amongst the Likert scale. Questions about the survey or the data that was collected at that time? Yeah,
What
Shannon.
percentage of staff took the survey?
It was a lower percentage of staff. I think in total, let me see if I can quickly answer that question for you. Out of the whole SAU, 156 staff members answered that question, and we have well over 400 staff. So it wasn't nearly as representative as the parent group. Stephen O'Keefe.
What's the plan to re-engage people with a survey this month, next week? How many times going forward? Yeah,
so I think that that's something we should ask the same questions on a routine basis and see if there's a trend, if we can track that. That was a question I was going to ask that you led me right into. Does this group feel that that's appropriate to resurvey everybody with the same exact questions to track those trends? I'm seeing like thumbs up and nods. No one's like waving at me with, okay, my Zoom interpretation skills are telling me that that's a good plan, so we'll do that. Any other thoughts or questions about the survey or the data?
Just a quick question. Does the 2-to-1 ratio that this seems to reflect, does that hold true to the state results that you just talked about, or have those come out yet?
Mike, I don't think those have been released yet. Have any of the survey data at the state level come out?
No, the survey has not been released at this point, the results of it.
Very good. So I think that data tells us something pretty important, which is, in my mind, we've got a significant challenge about how we're going to structure school in the fall, because we can't simply say, well, we've got 2/3 of our staff and 2/3 of our students that are going to show up. It's not as simple as that, because not only will those numbers not match up perfectly at various grade levels or various schools, but things are going to be dynamic and changing, because I don't foresee us having anything short of very strong protocols about when someone does have a fever and when they're allowed to come back and participate in our school. And so there will be people, if we have any kind of dual option, where they'll be going back and forth between the two over the course of the next school year. And so that's a pretty complicated and nuanced thing to sort out. But that's how I read that. I read that there are people who feel very strongly that school needs to reopen, and there are those that absolutely believe their kid isn't coming to school. And again, I'm just going to share my bias, which is that tells me that anything with a split session where we have half of our kids come one day and half the other, or half one week or half the other week, or group A comes in the morning and group B comes in the afternoon, I find that is not going to serve anybody in our community very well, because those who want their kids in school all the time are going to be very disappointed. And those who aren't going to send their kids to school aren't going to send them, whether it's an A day, a B day, a gold day, a black week, or whatever we call it. We're going to have significant gaps in our attendance no matter what plan we come up with. And so I'll just share that as a bias. I'm not, I'm flexible, but in my conversations with people, to me, I think individual choice is going to have to be a big part of what we come up with to make this work over the next year. And that's my starting point here with all of you, subject to all of your input and change over time.
Adam?
Yes, sir. And then Peter King after.
With respect to the staff and looking at the discrepancies between elementary, middle, and high school, and and again, you may not have the response that you were looking for to give you some accurate forecasting there. But nevertheless, I'm not surprised that high school people feel less inclined than some of the other people with respect to feeling comfortable going back to school. And I think that's their nature, which leads me to my next observation. Have you included somewhere in this task force the leadership from the unions in terms of where we're going as a district and where we're going as a staff to make sure that when the decisions are made, that you've got the group that represents them is behind the decisions as well?
Indeed. So our faculty, staff, and association subgroup is made just for that purpose. We have 3 associations, all associated with NEA of New Hampshire. The Amherst teachers, the Amherst support staff, and the Mount Vernon teachers. And then we have a 4th group, which is not an association, but is really a committee that's not associated with any bargaining unit and is not a recognized bargaining unit at Sauhegan High School, that we refer to as PPC. The letters of which I always forget, but it's just PPC. I've seen Jolene and Steve here acknowledge that. So that subgroup is going to be critical because we simply cannot make a plan if our faculty and our teachers and our support staff and our custodians and all of our bus drivers, if the whole band isn't playing together, we're not going to make a good song together, for sure. Peter King, you were next.
Yeah. So I just want to share something. I'm involved in a professional association of engineering firms, and we're seeing something in the workforce that I think is reflected in this survey. We have currently among the engineers in New Hampshire, and this covers most of the firms, there's about 10% of people who have gone back into the office. There's about a third of the people that are saying, I don't want to come back at all until it's safe to do so. And that may not be this year or next year. So I think you're seeing the same kind of percentage of teachers and stuff. I think we're going to see a global shift in work, which also impacts education because parents will be home more than they were in the past or something. I don't know how that's all going to play out, but I'm not surprised at all with the survey results of the teachers who said, you know, a third of them say, I don't want to go back to school until it's safe. I'm not surprised at all.
Other reactions? Yeah, Jolene.
Adam, do you have, I know you said you didn't have as many teachers respond to the survey. I was wondering if you knew what percentage of teachers had responded in each school. I think without that context, it's hard to understand what those percentages really reflect.
I didn't break it down that way, but one of my to-do items is to resend the survey out. And so hopefully we'll have even better participation this next time around. And I will track that to see what percentage of faculty answer the question.
Adam.
Yeah.
I like the idea of sending the survey out as the summer goes on, as June and July go on, to gather information on where people are at as things change in New Hampshire and as protocols change from the federal government and other professions and other organizations, as opposed to coming out and making a plan public, like, hey, in June, we're calling for this in late August or September. I think there's a lot of unknown, and I think behind the scenes, this committee can work on different options and variables, but keeping it kind of not public as far as like what the plan is, because I think that could change. And I think some of the school districts that are jumping out to do that, it's a bit premature based on the information and conversations that I've been involved in.
It's a really great point, Mike. I've always been one to just be out there and wrestle with these things in public, but I'd be curious what the rest of the group believes. I will tell you that some fellow superintendents are not enjoying life right now because they put out some of their early plans, and that's not gone well. So to Mike's point, I think there's something to be said of that. I will tell you that maybe in some of those places they didn't have a committee or didn't ask anyone else's input before they put that plan out there. I think that might impact community's reaction. But thoughts, does this group continue its work in public? Kim Roberge, I think you wanted to say something.
And again, from the selectman standpoint, we're putting out something as to if you're making appointments to come into the town offices as to what our protocol is and what our expectations are, visitors or appointments are. But we're not opening anything up yet, not even on Monday. Our statement that we're making is that, you know, the opening dates are based on evolving criteria, and we can't give that yet. Nor do we want to. I think that would be somewhat of the same approach that this committee would continue to take as we try to answer some of these questions. Our concerns are if you give dates or actual plans or something put forth, the first thing that people hear are what they're going to go by. You know, our expectations at this point from the town are going to be that visitors have to use hand sanitizer before they come in, and they have to be masked or they will not get service from the town employees based on their safety and the employees' safety. But that's about all that we're saying at this point. So that's input from at least where the town is moving at this point.
Reed Panicetti and then Shannon Gascoyne.
It's actually my wife, Nancy, has the question.
Hi, Adam. I was just wondering in the survey about asking parents, would they come back if there could almost be a sub question, like, are they thinking like if they said, no, I wouldn't be comfortable sending my child to school, are they then expecting remote learning? Like, is it one or the other? Either they are in or they're not. And like, would teachers be expected to still be, you know, providing instruction for the students that are staying at home, plus the students that are physically in the building? You know, maybe there needs to be some sub questions too. Like, if your child didn't attend physically, that means you're homeschooling. So it would be up to you to provide, you know, the instruction for your child. That may change some parents' minds. I don't know.
That's a great question. And might I point out what a great timing you have on your choice of retirement date this past year.
I'm on your clock for another few weeks.
Thanks, Nancy. Shannon Gascoyne.
So just a few thoughts. I struggled with the survey a little bit as a parent for some of the reasons that Kim and Mike mentioned. In my mind, I kind of was feeling like, well, I don't know what the state guidance is. I don't know what we're doing at a federal level. Like, there were a lot of unknowns. So I think continuing to survey the community is really important. I think focus groups will be really important. I think we do a great job, and the SAU has done a fantastic job in conjunction with the town throughout the course of this whole thing, really connecting in meaningful ways with our community. So I think we need to do that. I know, though, myself as a parent, and what I hear from a lot of other parents is answering some sort of vague question about what would you do without having any semblance of an idea what those options may look like is really difficult. I think some of your answers may look different, and even with the A/B schedule, if people had a concrete idea of, okay, you have, you know, 4 options. So I guess what I'm saying is sort of a blended version of what Mike's saying, like, let's get some work done in the background. Let's give people some idea of what this could look like and keep engaging them in the conversations to get those answers.
That's great. So the administrator group is going to be tasked with, I can tell you already, they're going to be tasked with brainstorming the different modality options to bring back to this group for feedback. And so that's, I can tell you that's going to be step 1 for them is coming up with those various things that can be asked of this group and then incorporated into surveys down the road for sure. I agree with that. Dr. LaBranche, and then I want to get back to the question that Mike put on the table.
I'm actually going to support what Shannon just said. And I would encourage the group to be as transparent as we possibly could. And I do think you have to have some specific information to share with them so that they're reacting to something that's fairly concrete and not something vague. Whether it's giving them a multitude of options as Shannon described, or whatever our approach might be. But I think in this time and what is going on, not being transparent is only going to destroy any kind of solution that we come up with.
I'm sorry, Jim Manning and then Amy Facey.
No, I was just gonna. I support what Dr. Manch and Shannon have said. Just my experiences of when you do these things, you know, it just doesn't serve you well. The other thing is, when I made my comments earlier, I think I had said that, you know, this situation is so fluid. We don't have a really good grasp of what's going to happen over the next 2 to 3 months. We can guess. So the more transparent we can be to bring people along with regard to what some of the odds are going to be, that's important. And the other, to answer the question for Mike, I'm very in favor of this being transparent. The other thing, though, is that as long as we operate from fronts that have what I would consider to be a high level of legitimacy, like, you know, the CDC has a school reopening framework of questions that you should ask before you decide to send kids back into the building and staff back into the building. You know, as long as we adopt some of those frameworks, make those transparent, we can bring the community along and there be some legitimacy there. That would be my guidance.
Thank you, Jim. Amy Facey.
Yeah, I would agree with that. I know we can't get too far out ahead of our skis. However, I think that if we do think there is going to be some form of remote learning, then we need to devote some time to professional development for our staff. They had to jump really quickly and put that into implementation mode this spring. And I think we need to provide support for them over the summer so that they can be set up for success. So in terms of curriculum planning and assessment mapping and all of the work that that staff needs to do in order to prepare for that.
I completely agree with that. Jolene Sawyer.
I agree with Amy, and also Adam, when you were talking about going over the different modalities, did you say that would just be an administrators would be on that task force, or will there be teachers who will be working on that as well?
Yeah,
I would propose that teachers are also part of that group.
100%.
Okay.
My suggestion was that administrators brainstorm what options are possible and bring those options back for feedback from all the rest of us. So
okay,
just in terms of tasking and making the administrators do the hard work, and then we can all shoot holes in it when they bring it back and tell them why they did a terrible job. That was my thought process. So Anna, get on that. Other reactions. So to Mike's point, I would say that I agree in some way that there might be a time that we need to have conversations that are not for the public eye, because, you know, even what I just said, you know, I said I'd like the administrators to wrestle with ideas and bring them back. That could be misconstrued, right? Wait a minute, are we not having teachers? And I'm using that as an example, Jolene, sorry, but our community will listen to part of our conversation and make assumptions. And so we do have to be very careful if we remain in public, that we're very clear about what is a finalized decision, what's in process, and what we're just thinking about, because it's possible that rumors exist in our two towns at times. So we'll have to stem that.
So Adam, I just want to clarify my point. I'm not saying not work transparently and not work in public, but, you know, kind of control the message and have a plan when you roll out and work with the different stakeholders and community members. and not try to wed or marry yourself to anything too early, because people who may be going down that path are getting some pushback and they look a little premature. And that's really what I was getting at. Just have a plan on how you want to communicate and interact with the community members, and kind of control the message and be real transparent about what information you're looking for from them, and thinking about those 3 points, like student safety, family's comfortability level, and then an equity piece of it. That's what I think is important.
Totally agree, Mike. Steve Dreher.
So I'm just thinking about this, and given what Jim had said earlier about the ongoing uncertainty and the sort of dynamism of this situation, is there any sort of schedule where we say, we'll make a certain decision by X date and we will do, I'm just curious because I feel like that would go a long way in sort of easing people's anxiety around all of this stuff, if they just know when the information will come out.
Yeah, so that's a great question. And I want to be really clear on this point. So first, so this task force is really made to guide me in the decision-making process that I bring to our boards and our community and say, this is the plan, right? So all of you are here to help make sure I don't screw this up too badly, all right? And then as I bring this forward to our boards and our community, we need to make sure that we have done the work to build consensus in our communities before that happens. In my mind, I have August 1st in my head as if we open school on time, which that is a question, right? If we open school on time, which is August 31st, I don't see how we can't have a plan in place by August 1st and expect families to be ready for that. In other words, if we say, we can't say on August 20th, we're not opening school. We can't do that. Families have to plan, have to have their plans in place to be prepared for that. And I don't think any earlier makes sense either, because it is such a dynamic situation. So if we start on time, in my mind, I think we need to have that plan ready for August 1st to publish and make available, and then to execute it, because whatever plan we put in place is going to require a lot of support for our teachers and support staff to be ready for it. And I need a month to do that. I know we do. I know we need the month of August to do that. But you folks tell me, is that, it's somewhat of an arbitrary date, but I find it's the right balance between waiting too long and not waiting long enough. Thoughts from the group? Anna?
Adam, definitely. I think we've been talking as a staff and a leadership. I think August 1st is really the go-to pinpoint time to really, provide feedback and know what we're doing, and giving us enough time to put a plan in place, or to execute the plan.
Adam?
Dr. LaBranche.
As Stephen Covey would say, we need to begin with the end in mind and take first things first. Given you want to have a plan out there that's accepted, if you will, that's what I'm hearing, by the community, this group and your decision-making process is going to have to be ramped up. And you're going to have to obviously incorporate what Jim Manning has to advise us with respect to the scientific information that's coming up. Because I would suggest, as Shannon recommended, that there's going to have to be a series of focus groups. And this is, here we are, what, June 11th? If by the middle of July, you're not having focus groups to discuss the various options, I think that there could be an implosion, quite frankly.
Agreed. I'll save my list of next steps for a minute. Nate Jensen.
The other thing, just to be clear, is that in addition to the sort of general plan that you need to have in place, there will be contingency plans too, assuming that things could go difficult later. So just to make absolutely clear, there will be a general option that will be followed, but there's got to also be several different options to deal with contingencies too. So that'll be also articulated in all of the communication and development basically. So.
Without a doubt. Yeah, we are going to start the school year with what we think the plan is. Somewhat like last school year, it might end differently. Jim.
Yeah, just two things. First, Dr. LaBranche, thank you. I just hope the community doesn't take my scientific expertise in terms of what we do, but we source the right people for that. The one thing that I'm concerned about with the August 1st date is just how quickly first date, if we decide to earlier, that's what we would do. One of the things that we should be thinking about as a strategy is to take advantage of the fact that with warmer weather, you can have people outside longer. You know, we know that, you know, there's a lot of good scientific data and experience behind the fact that, you know, as soon as it gets colder and you get people back inside buildings and all of that, you know, you start to have outbreaks. So the August 1st date just sounds a little late to me. I don't know, that's just but you know, you have a better sense for how quickly we could turn the key to get kids into the building than I do. And we'll leave that up to that group. It's just something we should consider.
Well, I agree. So to my point, if we start on time, it's August 1st is the date. But I do think we need to wrestle with what has been brought forward as, is it possible to start school earlier in a time when we expect there to be less transmission? Deanna Quartz.
I was thinking that August 1st is a good date because we don't know how things are going to go, whether we're going to have another surge coming up. We're doing okay right now, but some states are finding increasing again. So I'm thinking August 1st is, if we know earlier, that's great, but I think we should set a date of when we let everybody know. And I think August 1st is perfect. We'll be able to get a better picture, as will the government officials and scientists as to transmission and how we can prevent it and safety measures. So I would hate to see it much sooner than that.
Thanks, Deanna. Katy Kennedy.
Not to be a Debbie Downer or anything, Adam, but just addressing something that you've probably already thought about, but just thinking about teachers' contracts when we're talking about coming back early, or, you know, all the training that we'll have to do ahead of time. So I know you, and I'm sure you've thought about that, but just wanted to throw that out there.
Yeah, it is not like we can say the train's going to leave a month earlier. It is a bunch of people, and there are significant contractual and logistic issues associated with starting school earlier. Doesn't mean we don't look at it, but if we're to both Dr. LaBranche's and Jim's point, if we don't look at it now, it's not going to be an option for us. Shannon.
One other thought to consider with starting earlier. It's great if we can be outside, but I'm guessing some portion of the children and teachers would need to be in the building. Our buildings are really hot, and there's not a lot of airflow going on in them. So I think that could be a problem. You know, I don't know, something to think about. And also when we're talking about surveys and things, I'm also would be curious about surveys for parents in terms of the experience they had with distance learning specifically. You know, what worked, what didn't, because, you know, at some point that's likely to happen again, whether it's a snow day or, you know, a second wave that has us all under quarantine.
Agreed. Stephen O'Keefe.
What subcommittees could be covering the school start date? So if we did decide, or if it was an option to move it into maybe mid-August, what would be the timeline for them to report back to the greater committee?
So a couple part question there. So I think, and I have a list of to-do items that I was going to talk about to wrap us up. So maybe it makes sense for me to start doing that now to help answer those questions. The to-dos that I've collected so far just from this meeting are to continue or to repeat the survey that was sent a month ago of parents, even though the survey isn't perfect, to Shannon Gascoyne's point. just to track trends and of our parent community would be helpful. And so we'll do that. A second to-do item that I have and someone mentioned was, are we getting feedback about how remote learning worked this past spring? What went well and what didn't? Anecdotally, I know that our teachers did an exceptional job on the connecting piece. That was our focus, and that was the thing that we highlighted and drew a lot of attention to. But our teachers will need additional support in terms of the academic side to make it continue to be as an effective thing. If it was as effective as regular school, we'd probably do regular school differently, right? So we all know it's not going to be perfect, but there will need to be additional support for our teachers to make sure they're successful if we have to move in a remote environment in the future. Other to-do items are some tasks for each of the subgroups. My request is going to be that each of the subgroup chairs work with me on setting a meeting date where you can meet with people of your various constituencies. And so I have a survey that I'll post the link to it in the chat for everybody who's here to participate in if they'd like. Let me do that now. So this survey is asking if you want to participate in one of the subgroups. You can sign up for that. So it's a Google form. We'll put it on our website and our Facebook page for people if they want to sign up. So if you're a teacher, you're a parent, a community member, a medical professional in the community, any of those things, and you want to participate in this process, that's how you let us know that you want to do that. But along with that, I'm going to ask each of the subcommittee chairs to work with me to set that meeting date, and as a first meeting to simply gather feedback from people. And I intentionally open-ended, right? Because I think our first step needs to be to collecting feedback from our community. What has your experience been thus far? What has worked, what hasn't? And find those themes that then we can report back to this big group. Engaging our subgroups that way initially will set the stage for them to be in a good position to collect feedback on our plans once we have more specific plans down the road, by saying, now we've heard you, what your feedback was thus far, but what do you think about our plans moving forward? And then more specifically for some of the individual groups, principals and administration, Anna, I'm going to ask you, as I mentioned in this meeting, as your first task is to brainstorm all the various modalities of school that we should consider for the fall, including starting early. So along with some pros and cons of each, as you as administrators see them, that we can all have and discuss at our next meeting or the one after, but our next Thursday would be the preferred time to kind of chew on that. For our faculty, staff, and associations group, if that group, Stephen and Amy, if you guys could coordinate a meeting with all of those teachers that want to participate, the association heads that are interested in being involved, and start that process of collecting their input on this process and their feedback of remote learning in the spring, because that's critical information from our folks. And perhaps I'm just thinking of this on the fly, perhaps you ask the question, is starting early an option? And if so, what things have to be considered for that to be something that works with our collective bargaining agreements and the realities of being a teacher? So I'm adding that as a last minute thing, but does that make sense for you guys to even ask that question as in the initial meeting? Okay. For our parents and community members, so that's Shannon, again, collecting feedback about what's worked and what hasn't so far, and then parent ideas about modalities. Far-reaching, I'm sure you'll get a lot of answers, but having that feedback from our parents at first will be, I think, really helpful for us. The other thing, Shannon, I was hoping that group, from an initial standpoint, could let us know their gut reactions about the data that's coming in right now. You know, I'd be really curious for the parents that showed up to this initial meeting. How are you feeling about what's going on? I know that's a wishy-washy kind of question to ask, but I'd be really curious what people have to say in that group from the beginning. Georgia, if you're comfortable, gathering together students. They may not fill out the Google form like everyone else might, but I'm sure you have other ways of connecting with students. Be happy to have you also include elementary and middle school students if they're comfortable. And again, just have that initial gathering of input meeting and establishing that relationship so that when we have plans moving forward, we can get some good student input. Does that sound okay, Georgia? And then finally, and Shannon, I'll come back to you in just a sec. School nurses and community medical folks, whoever signs up for that group, Jim, I just ask for you to, again, see what resources we should be relying upon during this time. I think we already have a good number of them, but what should be informing this group in terms of our decision-making process? Is it the WHO? Is it the CDC data? Is there another source of information and resource that we should be relying upon as we make our decisions? So does that make sense for an initial meeting of that group? Okay. Shannon.
For folks who are watching on Facebook Live or who may, replay this later, can that link that you shared to the Google Docs, can that live somewhere, like, that folks can access it other than the chat?
Absolutely. Yeah, we're going to post it on our Facebook page and on our website as well. Jim.
Yeah, just a quick logistical question, Adam. Do we know, or have we surveyed, or we have data on the students and the staff within SAU39 who are at high risk or immunocompromised?
I've not asked that question of anybody in a survey form. Maybe I'm a little afraid to ask that question, but maybe I shouldn't. Perhaps I shouldn't be afraid to ask that question. Peter King, your reaction told me I shouldn't.
Yeah.
No, you should be very afraid.
No, do we have? Yeah, we might know though. I don't know if the school nurses keep that, because there are some students who might be immunocompromised or high risk for other things that we would know that. I know we can't share that publicly because of HIPAA, but we should have a sense for what the N is, like what number, because any effort to get back into schools in the fall, and those folks are going to be at significant risk. So.
Dr. LaBranche and then Peter King, if you guys would weigh in on that.
No, my point to piggyback on what Jim was saying, knowing the end obviously would be important, because obviously see the parallel between that and students with special needs, because we're both at the administrative level and at the teacher level and at the parent level, we're going to have to take into consideration different modalities for these children. That's pure and simple at this point in time.
So my only comment, I was shaking my head, clearly because HIPAA, I don't think we can ask who is immunocompromised, or not in a survey at least.
No.
I also think the issue I see is not with children getting sick. The issue I see is with children bringing home a virus to parents and grandparents. So that the immunocompromised children question is not going to answer that question, which is, I think it's my biggest fear. And statistically, this is something that impacts people in their 70s and 80s and beyond.
One reason I've not had a chance to have my monthly luncheons with my mentor, Dr. LaBranche. Georgia Craven and
Thank
then
you.
Georgia and then Steve.
Yeah, my point was just for a little bit earlier, but I haven't heard anybody bring it up yet, so I'm just gonna bring it up. But I think we need to watch what happens in the rest of the state in the next few weeks, because if like businesses, stores, restaurants, other childcare facilities are all opened by the time school's supposed to be open, then you have teenagers already going to stores, going to any extra thing that they have outside of school. Parents are working, you have kids at home now with no childcare. And then there's so much, everyone's already being exposed. So then people might just be like, well, why aren't the schools open? Everything else is open. So I think we need to kind of keep that in mind as well. Maybe it might not be the safest option, but it might be our only option if there are kids now going to be at home with no childcare and no access to internet, maybe. I think that's just something we need to keep in mind as well.
That's a great point. Steve Dreher.
Yeah, just the way the conversation was going had me thinking about the potential ongoing trauma for students and community members. And I know that was a lot of what guided our decisions around how we did, distance learning in the and I was noticing, I don't think there's a social worker or school psychiatrist or psychologist on the panel. I just wonder to what extent this committee should also be considering that, because again, like, it's so dynamic, and that kind of trauma could really be detrimental to people's ability to engage.
I completely agree, Steve. I hope that some of our social workers will be comfortable engaging in our subgroups. By the way, there's already 23 people that have signed up for the subgroups, so that's wonderful to see. Okay, final thoughts or questions? Our to-do list. JM, go ahead.
So I apologize if this was already asked earlier, but have we considered different modalities for different schools? Because I think the different age groups represent different challenges. And the last thing I want, to happen during the school day is where the teachers have to essentially spend all of their time managing, especially sort of the younger age groups who, may not be able to keep masks on, will be fooling around with one another. And so you really don't have the time to actually do any teaching because you're more or less sort of policing the different age groups. I think once again, the high school students, you can reinforce them wearing the mask, staying a little bit more separated. Younger age groups, I think that's a much more difficult option. Obviously, if you're looking at doing different modalities, that significantly increases the complexity of trying to, educate our students in the SAU. But I just wasn't sure if we had talked at all about that or considered that option.
We haven't yet, but everything is on the table. And to that point, JM, and JM let me know, he's got another commitment on these Thursdays, but is graceful enough to join us when he can. So we appreciate that. But something I feel is important to mention is, remember, for those of us who've learned about Maslow's hierarchy of needs, we're not going to be teaching students who are not feeling safe at school. And we're going to have to balance what it means for kids to be in an environment that might not feel safe to them, because they're not going to learn if they don't feel safe. Just like a kid is not going to learn if they're hungry or they didn't get enough sleep the night before. And so one thing we will have to balance, and again, maybe this is my own personal bias that's bleeding through, is how much different is school going to look like, and to what extent do we balance that with our need to keep kids feeling safe and making these decisions? Because I'm concerned about that for sure. So, Kim Roberge.
Just to follow up on JM's comment on that, there was a question that came from Mount Vernon residents from, if we're looking at the elementary school, is the amount of students per classroom and the differences between the space between Clark Wilkins and what Mount Vernon Village School has. So keeping that in mind when addressing the modalities as well. Though we are one SAU, that is, a concern for Mount Vernon residents, that decisions would be made based on the number of student to teacher ratios in the lower grades in Amherst as opposed to what they are in Mount Vernon.
It's a great point. Mount Vernon Village School, we have class sizes around 15, and we don't have that at Clark Wilkins. So that's a very valid point that we need to consider for sure. All right, closing thoughts. Our to-do items I've listed out. I'm happy to have each of the subgroup chairs reach out to me individually for us to talk through scheduling a meeting and going through that process of connecting with the other folks in that committee. We will meet again next Thursday in the same format and continue our conversation next week. I'd like to have each subgroup report back to us next week about the themes of what they heard with the groups of people that they met with, and for our administrators group to present to us those set of options that we need to consider in terms of modalities, along with the pros and cons of each. No recommendations yet, no need for that, but just a brainstorm of what might be great options, it might be bad options for now, but when we wrestle through them as a group, we might find the right option in there for us. And that will be our meeting next week, is to start wrestling through that process. Any final thoughts? All right, well, thank you all. What I'm going to do is stop recording this meeting. There are several questions that have been posed in the Q&A feature here, and I'm going to stay on and try to answer those. Some I was able to get to during the meeting, but wasn't able to get to a lot of them, so I'll stay on and answer those. Anyone else who wants to stay on and have a conversation about anything else afterwards can do that, but otherwise I'm going to end the recordings.